So let's talk about fibromyalgia. So this unexplained full body pain, or have you worked with any people with fibromyalgia?
Yeah, I've worked with fibromyalgia and other autoimmune diseases.
And I've been told by some doctors that's very tricky and almost impossible to take care of. Some doctors have told me it may be in their head. It might be psychological. So what are your thoughts and what are you seeing?
Fibromyalgia, I think, becomes what we call a wastebasket diagnosis. In other words, you work people up, people come in, they have aches, they have pains, they have fatigue, they have a lot of vague, what we call vague constitutional symptoms. You can't find anything to make a specific diagnosis. So based on the symptoms, a lot of doctors will just say, I can't find anything wrong with you. It must be fibromyalgia. Well, if it is fibromyalgia, I think it's an autoimmune process. And if it's an autoimmune process, it's going to respond to this. We're just finishing the second bottle. I'm going to go back up.
So you've had people in here that had fibromyalgia, and it's helped them.
I've had a number of people with fibromyalgia that it helps. It definitely helps them with their energy, because a lot of people with fibromyalgia have a lot of fatigue issues, and they feel awful all the time. So it decreases inflammation, and it helps with the pain, and it helps with the energy. But I had a patient just recently, a young woman, who came to me and wanted treatment for fibromyalgia. And talking to her, it didn't seem like she really had fibromyalgia. I mean, make a long story short, I worked her up, she had Lyme disease. Nobody ever tested her for Lyme disease. The good news is, this helps both.
So from going from complete exhaustion all the time, having some symptoms, to feeling good.
Yeah, they get better little by little. I don't know if you can notice on the camera now, but his blood is actually brighter red.
It is bright red.
Yeah. And this happens little by little over the course of the treatment, because your body's now going to start to get more and more saturated with oxygen.
Okay, good.
Which is going to be very healing.
So for people that want to think better, think clearer, let's say I'm giving a big presentation the next day. This is good for that, right?
Yeah, this is great for the brain. It's also been shown to be very effective and helpful after some incidents, like after a heart attack, because you know, when you have a heart attack, part of your heart isn't getting the blood supply that it used to, and the brain after a stroke. So we don't do it right after, because there could still be some bleeding issues and things like that, and we're using an anticoagulant. But a week or two later, after things have calmed down and healed, it's a good time to start getting ozone. It's also very good to help heal after surgery. I had back surgery a year and a half ago, and I came in here and I had my nurse start my ozone treatments, and I was doing 10-bottle ozone treatments 2-3 times a week. And I was actually so healed. I had my surgery in December, and after New Year's, which was like 3 or 4 weeks later, I was skiing.